So, like I said, my name's Becky, and I have been doing sort of mental health activism and campaigning for what feels like my whole life, but it's only been about 6 years in reality. And just to sort of bring the start of my activism journey, I'm gonna paint you a word picture. And basically, I was sat on the front lawn of the Northern General outside A&E, and it was probably about 5 in the morning. It was a really hot summer's day, and the sun was just rising, and the birds were in the trees, and you could hear the traffic just getting going. And I had just attempted suicide, and I had been discharged from A&E with no care whatsoever. And I was just sat there watching like this beautiful scene, and I just thought, I could not possibly feel any worse than I do right now. And there are so many other people who are going through exactly the same thing. And I just kind of thought, well, when is this going to end? Like, what is going to happen? So at that moment, I was like, right, well, I don't think I could feel any worse. So I'm going to try and make sure that no one else has to feel this way if I can help it. So I started fighting and I started fighting very hard. And what that looked like for me was joining sort of campaign groups like Chili Pep Stamp Group and Young Health Watch. So Stamp was, is, sort of a group that creates campaigns and influences services around mental health. And Young Health Watch was sort of a group that helped children and young people influence the services that they access. And I was lucky enough, after doing, I think it was about 2 years of volunteer work, to be employed by Young Health Watch, where I got to actually take a more active role in making sure that children and young people's voices in Sheffield are heard, and not just heard, but listened to and acted on. And from there, I worked for Time to Change, which is a national mental health awareness charity. Unfortunately, they've just had their funding cut, so they will be shutting their doors. But with them, I was what was the job role? Children and Young People's campaign coordinator for Yorkshire, the Humber and the North East. So working for a big national charity is kind of a different kind of campaigning, because you've got less, I guess, autonomy and less control over the campaigns and the activism you do, because it's kind of set out by like the people in head office. But what it does do is give you resources, because to, campaign and to do activism, you need like resources behind you most of the time. So that was kind of a weird thing to experience, but I got to have like a much further reach than I would have done just on my own campaigning and doing activism in Sheffield. I got to go all across Yorkshire, the Humber and the North East. And also with Time to Change, they funded a place for me to go to campaign Bootcamp, which is a really, really amazing tool for activists to gain the skills they need to create the change they want to see in the world. And it's also a really good chance to meet other activists from every other walk of life. Not just around mental health, but other issues like climate change and racial justice and LGBT issues. And it was really during that week that I'm massively upskilled as an activist. And using those tools, I carried on with Time to Change for a bit and started working with Mental Health UK, which are another national charity, where I was going into schools and training like teachers and young people in mental health. And at the same time, I somehow ended up working in frontline mental health services alongside my activism and campaigning work. And it definitely gave me an insight into like how mental health services work as a whole in Sheffield. And once you really know how the things are structured, who makes what decisions, and where funding goes, once you learn all that, you can really pinpoint the key places where you can influence. So you learn who the commissioners are, you learn who like the ward managers and the bed management are. And I worked in frontline mental health services for 3 years, and that was, yeah, it was definitely an experience and gave me a lot of stories to tell. But I think ultimately I left that job to do more, I guess, focused activism work, because I think to a degree working in mental health services is activism in itself, because you get to really make like tangible change in people's lives. However, there is a lot of issues around working in mental health and the toll it takes on your mind as well as your body. So I left there and carried on with Mental Health UK, did little bits with Time to Change and started doing that sort of stuff freelance. And then the pandemic hit. That was fun, wasn't it? Yeah, since then, I have started working with Chili Pep, running the stamp group that I was once a young person for many, many moons ago. So I've just got a couple of things that I think are really important to consider on any sort of mental health activism journey. So one big one is you need to check your privilege as a person. So for me, as a cisgender white person, it's my responsibility to make myself aware of the issues that other people face around mental health, around accessing services, around discrimination, because no social issue exists in a vacuum. Mental health discrimination and stigma is inextricably linked to racism, institutional racism, to women's rights, to LGBT discrimination, to ableism. You really need to find out as much as you can about every single group that the issue sort of affects. And there are really great ways to really like get into detail around these. There are a million books that you can read, and like blog posts, and on social media there are some really, really great ways to find out about what the situation is for other people. Because, you know, if you're campaigning for one thing, you can't do it efficiently if you're not campaigning for everyone, if you know what I mean. Just like linking into ableism as well, there's sort of a belief in activism communities that there's kind of not necessarily a hierarchy of activism, but there's the phrase slacktivism, which I really disagree with, because sometimes activism, just signing petitions and sending emails, that is just as good as any other form of activism. And if you're someone who's maybe housebound, it's important to include them in sort of your campaigning and activism as well. So if you're thinking, right, I'm going to do a mental health campaign where I talk to people who are suffering from mental health issues and finding out what barriers they face so that we can then talk to commissioners about it, you need to, I guess, make sure that it's accessible. And there are so many different ways to campaign and to be an activist, and no one is better than the other. I also think it's important as well to think about activism and campaigning as a mental health intervention, because I know I was very guilty of using my activism as a tool to keep my mental health well, because it works to a degree. You know, you really get an amazing boost realizing that you are making a difference in the world and you are contributing and you have a place on this planet when you are making change, but you still have a place on this planet when you are doing nothing whatsoever. So if you are like at the point where you're spending all of your time and all of your energy on trying to help other people and trying to make a change, and you completely ignore yourself, it's not going to work. Let me tell you. Sometimes activism is a really good distraction, but you know, you can't pour from an empty cup. You need to learn to say no sometimes, and sometimes that's a bit of a pride thing. I think it definitely was for me, because I would just say yes to every opportunity and really like get invested in people and in their stories and really taking on the burden of issues in Sheffield. And that's not good. It doesn't, it's, yeah, burnout is a very, very real thing, and your mental health is more important than your activism. It's really important to do whatever you need to do. And yeah, I think that's just a good advice point in life. Don't pour from an empty cup. You know, look after yourself first. But yeah, it does work. Activism is a really good way to boost your mental health to a degree. And it really works as well to boost your like confidence levels and your self-esteem levels. I think when you're sort of putting yourself out there and talking to decision makers and telling your story in the hopes that it maybe makes mental health professionals more receptive to the people they look after, it's a big thing. It takes like a lot of strength and bravery. And when I started campaigning, I was like, how am I going to put myself out there? Because I hated like public speaking. I hated people looking at me or acknowledging my existence whatsoever. But I think the biggest tip that I got around stuff like that is, when it comes to confidence, fake it till you make it. I know it's a cliche, but it genuinely works. If you go into a conference room with 300 GPs and you tell yourself that you are bad as hell, you can do that. I love public speaking. Oh my God, I'm so confident. If you tell yourself that enough, it does genuinely work. So, like, after that point when I was sat in front of the Northern General Hospital and I was literally at the lowest point in my life, my activism and campaigning has gone hand in hand from my journey up until this point, where I am genuinely happy and I have so much in my life that I'm so grateful for, and I love the sound of rain on leaves. And I know it sounds really like hippy dippy, but it's true. So yeah, it's possible to get from that place to where I am now, if that makes sense. So yeah, that's pretty much my journey, basically.
Thank you so much, Becky, and thank you for your honesty there. And I think Sandra Ann's just summed it up in the chat, saying that she's very glad that you're still here to share that with us, Becky. And I think that is, yeah, summed up like from all of us. Yeah, so before we open the floor to the Q&A, so everyone who's here, you know how it works, I think. If you use either the chat box or there's a little button down the bottom that says Q&A. Yeah, I'd just like to say a big thank you to Becky for that. And also just from a personal perspective, you were, I think, maybe one of, or the first young person I met on my first day at Chili Pep at a stamp session. So it's so nice to have you here as a colleague now and speaking in the project that I'm working on, it's really lovely to have that. So does anyone have any questions? Mia and Muskan as well, you are in that question. I'm sure people will, but I will fire away with one question whilst people are thinking. So is there any one person or anything that really inspires you with your activism, Becky, when it's going hard, when it's going tough? What inspires you to keep going?
I think that a constant source of inspiration to me is the people I've met along the way who are massively struggling. So whether it's people I've looked after when I was working in services, or just like people you know through your personal life. Like if anyone has experienced suicidal thoughts or poor mental health and they are still on this planet, I'm like, yes, you are the reason why I do this. And I know it's quite like, it can seem conceited, but I do it for myself. And like, it's important to consider the version of you when you were younger. I try to be the person I needed when I was little. So I just think of like me with that bowl cut, you know, massive glasses, chubby cheeks. I'm like, I'm doing this for you, girl.
I love that. I think sometimes we don't often say enough that actually sometimes our biggest inspiration can be ourselves, and it's good and it's okay to say that. So Mia, would you like to ask the next question, or one of the questions that's come through?
I would love to. So Jasmine wants to know what your next steps are.
Ooh. I think immediately in the next few months, I am just going to survive the pandemic. I think I think my point in life now is I want to help other people to campaign and to become activists in any way that they see fit. And also, I think I'd really love to get more into doing like intersectional feminist and anti-racism activism, because mental health, I've done a lot of it, and I want to sort of expand and use my skills to help other causes. So yeah.
Thanks, Becky. So Muskan, I think you're next.
Jasmine's asking, what kind of mental health education would you like to see in schools?
Ooh, all of it. At the minute, mental health is like a PSHE, like optional thing. And I personally think that we need to be talking about mental health in primary schools, not necessarily about diagnoses or poor mental health, but if we talk about mental health in the same way we talk about physical health, so having your 5 a day and exercising, maybe do 5 things for your mental health a day and doing the things that keep you well, because if we start like as young as possible and getting people more educated around mental health, then they're going to grow up to be like adults that can manage their emotions in a healthy way. I think there's a lot missing from the curriculum at the minute, in my humble opinion, but mental health is definitely up there.
Thank you, and back to Mia.
So Sandra Ann said, given your experiences within the support system in the NHS, is there anything in particular that should be the highest priority that in your opinion needs to change?
It would be hard to pick just one, but the one that springs to mind is the discrimination that people of colour face in mental health services. So people of colour are like, I think it's something like 7 times more likely to be sectioned under the Mental Health Act than white people. And I've when I was working in mental health services, we had a ward manager come into the service, and I was like, this is a great opportunity to cause some issues with these people. And I kind of said, like, why are people of colour so massively discriminated against in your service? And they were a bit like, oh, like they would do. But yeah, it's definitely something that needs to be even acknowledged. If decision makers acknowledge the institutional racism within mental health services, that would be a start, definitely.
Thank you. And Muskan? Oh, you're on mute.
What types of campaigns have you been involved in? What have these campaigns achieved?
So one of the first campaigns I was involved in was campaigning to get like a transition service. So there's CAMS, which is Child and Adolescent Mental Health Services, and then there's AMS, which is Adult Mental Health Services. And for people who are aged between 16 and 18, they're kind of dropped by CAMS, but too young to be picked up by AMS. So we campaign to create a service that supports people in the interim to like transition successfully from CAMS to AMS. And it's since been defunded, but it was helpful for a while. Other ones I've done have involved like social media campaigns, so getting loads of people with like lived experience of mental health issues to write blog posts with a hashtag. So that was with Time to Change, where it encouraged people to sort of talk more openly about their mental health, and also at the same time raised awareness. And I got some really really lovely heartwarming feedback saying that the people who wrote those blog posts found it like really empowering, and then started doing their own blogs that get quite popular off the back of that. When I was like a little baby campaigner as well, me and my friend were like, oh, this is terrible, we need to do something to change this. So we bought some, those rubber wristband thingies, and put a mental health related slogan on it. I can't remember what it was, but we got those printed out, and then we sold them to people to raise money for, I think it was Time to Change. And we did that by going into the Benjamin Huntsman on a Friday night and getting people to buy our wristbands to raise money for them, and it works. It worked. Also, letter writing to local MPs is it can feel a bit fruitless sometimes, but it is really important to talk to the people who can then go to Westminster and talk on our behalf. Same with petitions. It can feel like you're a bit of a drop of water in an ocean sometimes, but signing petitions and bugging everyone around you to sign petitions really does make a difference. What else? Oh, so also if you get in contact with radio stations, sometimes they will sort of keep you on as someone to come to when a story around mental health arrives. So with Hallam FM, they often come to me when they get a mental health related story through. And going on the radio is terrifying the first couple of times, but after a while it's like another day. And that is a really, really good way to get your voice heard. So yeah.
Thank you. Back over to Mia.
So Jasmine's asked, what could young people do for other young people who are struggling?
Ooh, good question. So I think there was a study, I think it was in 2019, that said that young people are like way more likely to approach a friend or a peer when they are struggling with their mental health rather than an adult or a teacher, school nurse, GP, things like that. And that's why it's really important that young people need to be equipped with the tools to manage other people's mental health problems, whilst also knowing the point at which you need to say, no, I can't support with this, like this is out of my remit. Sometimes being there for a chat, for a natter, for a bit of a rant, sometimes that is a really, really helpful source of support. And if it's sort of at the point where, you know, your friend is really struggling and you feel like you need to get a teacher involved, a really good way to support them to do that is maybe like facilitating that, or saying, okay, I'll come to you, to the pastoral officer or Mrs. Smith or whatever, just for moral support. Also, I think there are so many different ways we can look after our mental health. So for me, it's meditating and going running and stroking my cat and picking him up and putting him on my face. And these are things that you can support your friends to do, whether it's being like, okay, do you want to walk home from school rather than take the bus, and see if like that helps get some energy out, or like obviously might not be an option at the minute, but offering to walk your dog with them. Pets are very therapeutic in my opinion, can you tell? And yeah, just the fact that you are saying that you will support your friend, that's like an amazing thing in itself. Like if you're struggling and you know that you have someone there that you can talk to, like that knowledge and that idea of the safety net can sometimes be really, really helpful.
That's some good advice. Muskan?
How can young people get involved with mental health activism?
So there's no register that you sign, and then in return you get a badge that says you are a mental health activist. So a really sort of easy way to ease yourself into it is going on change.org or gov.uk and signing some petitions. I would say look for as much information as you can around the, you know, like topic in mental health. From my experiences, there are two kind of routes that you can go down with mental health activism, and one of them is raising awareness, so tackling stigma and discrimination, and then the other one is kind of influencing services and society in general. So whether that's talking to commissioners, talking to decision makers, or like I said, writing to your MP. And I also think that under the sort of raising awareness bit, a really underrated form of mental health activism is having conversations, because they have such a massive ripple effect that obviously you don't get to see right away, but they do make a difference. So whether it's talking to your like grandparents around why we can't use mental health stigmatizing words anymore, that makes a difference. Whether it's talking to your teachers about sort of asking them to do more mental health awareness sessions, or things like if you've got like a group of friends, you can be like, okay, we're all going to write a letter, or we're going to have a stall at this student fair where we're going to talk to as many people as possible about mental health activism. There are also loads of charities that you can get involved with. I definitely found that sort of joining up with bigger organisations was the best way to make a difference. So charities like Chili Pep, like Mind as well. Times change, obviously, but they won't be around much longer. Campaign Bootcamp as well have mental health specific campaign work going on. Young Minds as well is a really good charity that you can sort of link in with. So yeah, that's a couple there.
So the next question is from Katie, which says, what advice would you give to someone who wants to become an activist for mental health?
Ooh, I would say go for it. Like I said, there's no formal process to become a mental health activist. I think the definition for activism is someone who spends a significant portion of their time working to make change around a political issue. And mental health, at its basis, is a political issue. And like I said, just educate yourself as much as possible. Identify areas that you can kind of influence, and if you want to be really sort of structured around it, you can write out a bit of a plan. And also, like, raising money for charities is like a pretty cool way to go about things, and there are loads of charities that can help you sort of do that. But most of all, I would say check that you are in a place where you are best able to do that. So if you are wanting to start mental health activism because like you need a distraction, that might not be the healthiest way forward. It's totally understandable because that's what I did, but it does lead to burnout. So yeah, look after yourself before you try and change the world, I'd say.
Thanks, Becky. So the next question we've got is, do you have any advice for choosing what part of activism to focus on? I want to do everything, and my current thought is to work with activists from all groups and aims, but I need a starting point. I feel that one. That's from an anonymous question, but I feel that. What's your advice then, Becky?
I think just go for what is easiest and most accessible to you at that time. Like, if you already know people that campaign around specific areas in mental health, then go for that. If you want to be a trailblazer and sort of make your own campaign with sort of resources, if you want to like sell wristbands like I did, that's also an option. Also a really good way to sort of, I guess, start is like access the spaces that you already have connections to. So basically, something that I did was approach my old school and ask if I could come in and talk to the students and the teachers, because that's a really sort of, I guess, familiar way of getting started with talking about mental health and with making a difference. Because I definitely found that when I went back to my school, because I had so much that I was struggling with whilst I was in secondary school, and so many of these things went under the radar, when I then went back and told them what I had been going through and how they could have helped, that was a really, really impactful way to do that. And also it's kind of cool. You realise how much you've grown since you were in school, and it is weird because you see all your old teachers, but yeah, that's a really cool way to start, I'd say. And then just sort of see where it takes you from there, I reckon.
Yeah, I think if I could jump in with a little bit of advice, even though I said I can't answer that question as well, but would be on a really simple level, if you just ask yourself the question, if I could change one thing about the world today, and it could be something like really huge, like massive, that's not something that's going to just change overnight, but just go with your gut. What's your first answer to that? And then it doesn't mean that you can't ever campaign on anything ever again. You've decided that's your topic. Obviously you can change and grow from that, but that might be able to sort of put it into perspective in your mind, and then start working on that topic.
Definitely trust your gut.
So next question from Sandra Ann. In terms of mental health, we know it's not clear cut and can fluctuate at any time. What advice would you give to someone who gets an initial feeling and that they are starting to feel different to their usual feelings?
Okay, so like, I guess sort of feeling that they might be struggling a bit with the mental health. I think the need for communication with your support network is very, very important. Like, I think there's this belief that, you know, like how parents and grandparents are like, oh, kids these days, you know, we never had depression back in my day. It's like, you did. You did, mate, trust me. Just like having that self-awareness is really, really important, and don't what's the word, invalidate yourself, because that can happen, especially in sort of activism communities. The idea that overworking yourself and overburdening yourself with your activism work is a heroic thing. It's not something that needs to be encouraged at all. And like I said, you can't pour from an empty cup. If you are struggling with your mental health, or if you get to that point where you're like, I'm gonna burn out soon, like I said, communicate with your support network, go to your GP if that's an option. There are a number of different online web chats or helplines which you can talk to. And obviously, if you're at the point where you feel like, you know, you're really in a mental health crisis, it would be a job for A&E, really. Mental health services in Sheffield are accessible through a single point of access, which if you type in Sheffield Spa mental health, make sure you put mental health on the end, because if you type in Sheffield Spa, you'll get a lot of adverts for the wrong places. So pop that mental health on the end, and they're like a one-stop shop for accessing secondary mental health services. There are also loads of charities that offer support around more specific issues. Like for people of colour, there are charities around support for them, and sort of women's charities that offer sort of gendered support. So yeah, definitely, there's a lot out there. Don't ignore it if you're feeling like you might be going down that path.
Thank you, Becky. So another question is, how do mental health and mental illness connect? For example, I have misophonia, I'm sorry if I'm pronouncing that wrong, and it makes multiple situations stressful, which makes the misophonia worse. It's an issue around certain noises triggering the fight or flight reflex, and it isn't fun.
So mental health is sort of the generalized term for our emotional well-being and ability to cope, whether it's good or bad. So every single one of us has mental health, just like every single one of us has physical health. Mental illness is the point where it becomes like a chronic issue that affects your daily life. And there are a number of different diagnoses and a number of different experiences, which is why I think it's really important to educate yourself about everything. So for example, I might not have experience of like personal experience of things like misophonia, so I would want to research that and understand how people with that would sort of navigate mental health services, so that I would be fully informed on how to make the best change for that. I think, just like going on a rant about diagnoses, I think it's a very hot topic at the minute, I would say, because mental health diagnoses, in my opinion, have been politicised, not on purpose, I don't think, but certain groups are more likely to be diagnosed with certain issues. And I'm not saying that we don't need diagnoses at all, because unfortunately in the world we are in today, having a certain diagnosis will give you access to certain services, which is another issue that I want to change, but one day at a time, So yeah, before I get on a full rant about that,
So the next question is, are there any resources to help with mental health activism that you know of?
Time to Change have a resource library on their website, which has session plans, it has printouts, it has directions of what to do on, like, in meetings and presentations, and yeah, they're still up, and that website will still be running even after Time to Change close. And I'm sure, as many of you will know, Gen Z has an absolutely amazing activist toolkit, which I think will give you everything you sort of need for that. And also, like, linking in with other activists around that issue, you'll learn a lot on how to do things and what works. Because if you're thinking, right, I'm going to do a letter writing campaign, someone will have already done that, and you can find out what works and what doesn't work.
Thank you, Becky. And we will be sending out, Jasmine and I, early next week, information on how you can sign up to Gen Z's campaign training as well. So keep a lookout for that. So another question in the chat is, have you ever worked with Utopia, who I think is a youth empowerment charity?
No, I haven't. I've not actually heard of it. Oh, actually, no. I think I had an email around them today, or read a blog post around them, but no, I haven't. I will definitely look into it.
Check them out. So I think if anyone's got any more questions, please do pop some more in. I think this always sounds like quite a negative question, so please someone else come up with one to end on a more positive. But mine would be, in your activism, Becky, have you ever encountered any criticism? And if you have, how would you deal with that?
Yeah, so criticism is a natural part of life, and to avoid it would be rather foolish. And yes, I absolutely have. I think a lot of, like, because I was campaigning and I was doing activism work, because I had such a horrendous experience with mental health services, I found myself really, like, pardon the French, but busting the balls of people who weren't directly responsible for my experience. So I would be, I wouldn't necessarily be angry, but I'd be very passionate about what I would be talking about when talking to, like, commissioners and stuff like that. And I have had people say to me, like, you do know they're not the reason why you're mentally ill. Like, it's not their fault. And that sort of links into another thing which I wanted to talk about as well, that when you are trying to influence services, sometimes you have to do it in a palatable manner, because when someone who is deciding what funding goes where, if you're very sort of, not necessarily irate, but if you're sort of very emotional about it, I've found that they are not as receptive to what you are trying to say. Whereas if you are sort of taking a step back from the pain that you go through when you're experiencing mental health problems, if you sort of take that out of the equation and you're calm and you use words that they love hearing, like utilizing the voluntary sector and stuff like that, that's a really helpful way to sort of get your point across. Because I could scream and rant about the injustices that people face in mental health services, but as soon as you pass that point, people stop listening. And that was something I discovered the hard way, by people being like, you need to calm down, mate. And, you know, it's a good point. But yeah, I'm sure I'm going to face criticism in the future because I am a human and I am not like a perfect form of an activist. None of us are. We are all just trying our best, and don't let criticism sort of scare you. Just let it help you make yourself a better activist.
Thank you. I like how positively you answered what is potentially a negative question as well. Thank you, Becky. So yeah, does anyone else have any other questions for Becky? Becky, we've got about five or so minutes left.
I had a question to throw into the ballpark.
Ooh.
So like at school, I was very let down by like the mental health section of school. I was let down a lot, and that's led to like trust issues later in life when it comes to talking about like mental health and stuff. How would you like recommend some like for someone who is struggling to like go and talk to someone if they're struggling like really bad?
So if the person who is needing to talk is struggling, do you mean?
Yeah, like so like they have like severe trust issues, don't trust anyone. Like how would you like recommend for them to start opening up more and talking to people that they may not necessarily know or trust?
Yeah, I mean, I would say don't force anything that you're not comfortable with. Like these things take time, I guess, and I think it's a bit like that confidence thing about just faking it till you make it. And when I tell my story, like of my personal mental health issues that I tell people, like in a keynote speaker format that I do sometimes, I have like a fully rehearsed script of like my deepest trauma that people want me to talk about, and it's just kind of a muscle memory thing, if you know what I mean. And yeah, don't put too much pressure on yourself. It takes practice, and it is worth it, I think, because people really are receptive to real life human experiences. Because I know it's a bit weird, but I love making people cry because I know that they have listened to what I have had to say. And when I go around and deliver speeches and stuff like that in like a freelance capacity, if I can make at least one person cry, I'm like, well, at least one person has truly listened and they're going to go away from this like more informed. So yeah, it's worth it. I'm not saying make people cry, but you get the gist.
Don't just go out of your way to make people cry, but if they cry, it's a bonus.
Yeah, it's just a happy accident.
Nice. I'll just finish up just by reading some of the... Oh, can you hear me? Apparently my internet connection is unstable. Am I here?
Yeah, you're perfect.
You're fine.
Good.
Yeah.
Yeah, just wanted to read some of the lovely things that are in the chat. So Sandra Ann has said, not so much a question, but I think it's a fantastic thing, not only to be in the place you are now from where you were those years ago, but to use those experiences to influence change and help others. Go you. And Katie has said, well said. I definitely agree. Well done. You should be very proud of yourself, Becky. Oh, and we've had one more question come through into the question and answer box, so we'll just finish with this one. So we have a team of mental health ambassadors at school, and we try to do everything we can to help students and teachers. Is there anything else that we could be doing? So what would your main piece of advice be for what the mental health ambassadors could be doing?
I think making sure that you're sort of trained in as much sort of mental health awareness as possible. Make sure you're in the places you can be to make that difference. But sort of carrying on, spreading the word, the fighting the good fight, making sure everyone's sort of clued up on mental health to really get rid of that stigma and discrimination. And I am really a advocate for mindfulness and meditating, and I have found that that can be one of the most helpful things that young people can utilize. As soon as I started living mindfully, my mental health improved massively. So maybe like encourage form tutors to do a guided meditation or something like that. That could be really cool. Obviously it's not for everyone, but it's something to try. Yeah.
Great. Thank you so much, Becky, for coming along tonight and sharing your journey, and lots of really great advice as well to budding young activists. So I'm just going to pop in the chat box for people that have come along tonight just a really short evaluation form. So you just click on that link and it will just take you to a Google form to answer a few simple questions. But unless Mia, you want a final word to Becky, I'll let you finish.
I think it's like we said to everyone, just like well done for what you're doing, because obviously it's not always easy to talk about your experiences, but I think especially with mental health, because everyone's experiences are so different, I think it's just really good to see a positive story where someone's like being really down and then they've worked themselves up to like being at the stage where they can say that they're happy. So I think like just well done for what you have done, good luck for what you are going to do, and like thank you for sharing your experiences.
Thank you. You're gonna make me cry.
Oh, this is bonus.
You've done it, Mia.
Thank you so much for having me.
No worries, you're always welcome. And thank you everyone who's come along to tonight's Activism Series. And yeah, we'll be sending out information about the following Activism Series and the campaigns training that we're going to be doing in the near future. So yeah, thank you everyone. Take care and have a lovely rest of week.
Thank you.
Bye.